Do you think your child does not pay attention to details? Do you also think that this child is hyperactive and highly impulsive in the society? Come closer, don't go. This topic is for you. And then the society at large, every other person that is interested in learning. It is time for you to learn from me. And I have come today to talk to you about attention deficit hyperactive disorder, that is ADHD. Now, what is it about? It is a developmental disorder that is characterized by inattention, hyperactivity, and impulsivity. What can cause it? Well, no one knows what can cause this. Most mental health conditions are idiopathic, but then researchers have gone far, and then it can be thought to be due to genetic causes, it can be due to environmental causes, and then CNS depressants, like CNS problems rather, like the central nervous system problem. When there's a problem with the central nervous system, it can predispose this individual to having this ADHD. Who are the people that are at risk? Blood relative. If my mother has it, there is a tendency that I will also have it, and if I have it, there's a tendency that my children will have it. Blood relative. Exposure to environmental toxins like lead from paint, like all these people that paint, or that smell that comes out from that paint, that some people will see them inhaling it. It's actually something that can be obnoxious to the body. It can cause toxins to the body. And then pipes in older buildings can also have these environmental toxins. And then maternal drug use during pregnancy. There are some women that when they are pregnant, you see them taking a lot of alcohol, see them smoking in pregnancy. This can predispose the child in utero to having ADHD. Now, preterm babies, premature babies that were not up to 10, were not up to 9 months before they deliver them, they are at risk for ADHD. Now, how do we know the signs and symptoms of ADHD? Number one, remember I said there are 3 basic signs: inattention, hyperactivity, and impulsivity. So for the inattention, how do you know that this baby, this child of mine is not paying attention to things? Number one, they don't pay attention to details. You see them easily distracted. Little thing they have derailed, or they have deranged from the normal thing that they were supposed to have done, and then they are doing the other. They are easily distractible. They don't even pay attention to their homeworks. Even at school, when their teachers are teaching them, they don't pay attention. They cannot stay focused. Okay, they cannot stay focused in tasks, in play. Even when they are playing, they don't stay focused. They don't listen. Even when you are speaking to them directly, when spoken to directly, they don't listen to anything. They don't follow instruction. Yes, you heard me right. Simple instruction. Can you help me with a cup of water? And you will see that this baby will be acting opposite. Like they are very odd. They don't pay attention. They are inattentive to things. And they have trouble organizing tasks and activities. They misplace their handbags, their school bags, their pencils, their erasers. They can go to school with a full bag loaded today, and they are coming back from that same school with their even uniform. They will misplace their uniform in school, and the parents will be like, what happened? What happened to my child? What happened to your uniform? What about your school bag? What about your pencil? They misplace virtually everything that is given to them to go to school with, and they forget to do their chores. If you instruct this child, sweep the house before I come back, you will go out and come back meeting the house looking like that. That is inattention. Like they are not paying attention to things. For the hyperactivity, what do we do, or how do we know that this patient or this child is hyperactive? They are always on the go. They run about or climb chairs. You see them climbing couches. You see them, doing things that are even abnormal and do not seem to align with whatever is going on. And then they have problems sitting still or fidgeting. You can see them fidgeting. They don't sit still. Even when they are sitting, they are shaking. Like, what is the problem? The woman will be wondering, what is wrong with my child? My child cannot sit down in one place. It's always running up and down. Even when you ask them to sit down, you see them tapping their feet. You see them shaking. Their body is itching them. They want to stand. Please, madam, it is not normal. That is what we call attention deficit hyperactive disorder. They also have problems staying seated. Even when you have forced them to sit down, they will want to stand up. Madam, they want to stand up. You get, during activities, even during sleep, when they are sleeping, you see them kicking their legs. They are kicking. They are very active. Even in their sleep. It's as bad as that. So yes, that is when you know that this patient or this baby is hyperactive. Now, impulsivity. How do you know that a child has impulsivity? They act before they think. They are very impulsive. They shift easily from a topic. Before you even talk about another topic, they have deviated to the other. You will just know that this child is having ADHD, and then they cannot organize their thoughts. They are thinking, they are acting before they think. Before they even do anything, they have already done it. Before they think of something, they've done it already. And they have difficulty trying to pay attention, trying to be creative, trying to listen. They have difficulty with a whole lot of things. Now, when a child has this ADHD, how can we care for them? We will look for the care in the next video.